Yeah, Drago.
Welcome back to the Morning Blend. If you have dentures, you know what a hassle they can be.
Yeah, but now there might be a better option for you. Dr. Carl Drago is here with the EON Clinics to talk about the all-on-4 dental implants. Welcome back to the show.
Thank you.
Great
it's a
to
pleasure
see you.
to be here.
Yeah, you're so tan. We were just noticing that. We were like, were you on vacation?
Jealous.
Yeah, no, it's from soccer refereeing.
I didn't know you were a soccer ref. See, you learn something new all the
That's
time.
Right. Yep,
That's really cool.
Yeah.
So you do the soccer refereeing by day. No, I'm just kidding. And then the EON Clinics.
Yeah, my day job is EON Clinics. Yeah.
Talk about EON Clinics and what you specifically do there, because some people have seen your commercials before, so they're a little familiar with the name.
What we do basically is change people's lives, which is pretty unusual for a dentist to be able to do that day in and day out. We see people that are either dentally exhausted, and that's the term that they may use with us, is that they've spent thousands of dollars and hours in a dental chair, and they stay, and I still got this. I have ugly teeth, they break, I'm worried about the teeth falling out before a wedding reception. And some dentists have said that the only other option is a denture. And while that may be true, the better option involves placing dental implants and then having a prosthesis such as this fabricated beforehand. And
turn it toward the camera if you would there, and just hold it real still so we can get a shot of it.
And in the process of one day, we can take the debilitated or the ugly teeth out.
Okay.
Place the
there
implants.
You go. Can you take that off
and this comes
to demonstrate it? Okay.
And that's what the patient's jaw would look like. These 4 implants are in the corners of a box.
Okay.
And the prosthesis, this interim restoration, is screwed into it with 4 tiny little screws. The teeth are in the right position, and in the matter of 4 to 5 hours, we take a person, quote unquote, an ugly duckling, and give them this smile to kill for, making them a rock star.
We can prove that you make them a rock star with some pictures. Okay,
yes.
Starting with, first of all, this is kind of a closer up shot of the dental implants, and this is the all-on-4,
This
correct?
is all-on-4.
Okay, all-on-4, and you see the 4 different implants that go into the gum line.
Yeah, inside the bone.
Inside the bone, and talk about change. I mean, you wouldn't think that was the same person.
No, you wouldn't. And their eye, when I take full face pictures, which we can't show here, their eyes sparkle. I mean, their smiles are just to die for. So this particular person's, his chief complaint was he had 1 tooth that was missing a filling. That was just the tip of the iceberg for him. His problem was he had major gum disease and all of his teeth were loose. And fixing the 1 tooth was not really an option. The option was getting rid of all the disease, and there are systemic complications with bacteria from periodontal disease that they can migrate to the heart valves, and people can get very sick from this. They can get septic, they can be hospitalized, they can have the swollen face. And by removing all of the infected teeth and the infected bone, and we can place the implants and the restoration. So that particular gentleman, he came in at about 6:30 and he walked out like that at about 3:30.
Wow. What kind of recovery time? Because I can imagine, especially if you're removing some teeth, if anybody's had a tooth removed, it hurts for a little while.
It's a contradiction in terms because the prosthesis goes right into the implants, which go right into the bone. So the soft tissue is not compromised and it's actually protected. So most people don't even take a narcotic on the first post-op night. It sounds absurd, and they look at me like I've got, 2 heads. But for the most part, they take something like Motrin. We give them a steroid, and they take the antibiotics, and their post-op recovery period is remarkable.
That's incredible. And we've heard from your patients that that's the truth. And I wonder for people if they're wondering if they're a good candidate, because some people have some bone loss that comes with the gum disease or other problems.
So the bone that we use is part of the skeleton. It's called basal bone, so it's above the infected bone. So all that infected bone has to be removed anyway because it's soft, it's not stable, it's not like cement. And so we're using part of the skeleton, which doesn't change. And that's where we get our anchorage from. And that's why it's so successful. And part of it is knowing where to put the teeth, because once you remove the teeth, the landmarks are gone, right? So between myself and my surgeon and my lab technician, we have to put the teeth back in the correct position. And we do that by the preoperative diagnostic planning and then being at the surgery. One of the benefits of EON is that I am in the OR at the same time that the surgeon is performing the surgery. That's very untrue outside, because say there's a surgeon in Waukesha and the restorative dentist might be in Brookfield. Well, they really can't, you can't even Skype it for that matter. So it's better to be there for the whole time. And in our practice, the OR is right next to my prosthetic room, and that's one of the reasons why we get such good results.
You have a beautiful office.
Yeah. Oh, you've been there,
I've
right?
been in there with my mom.
Yeah. We still haven't seen her yet.
I know. It's a distance to travel, and
we need to get Mama O back there. But the thing that I love about what he said was, he didn't say, well, I change people's smile or I give them a new set of teeth. He said, I'm in the business of changing lives, because our smile is part of our face, and that's your first impression.
It's so true.
Exactly.
And I just think it's great because, you know, when you have a denture and you take it out at night, the whole structure of your face can change. And we don't have time to get into it, but just the fact that these are permanent, you know, for people, and they can just come in for a little maintenance, you know,
every twice a year.
Twice a year.
And we unscrew the restoration. What a cleaning appointment, right? It's not the scraping that we do. You unscrew it, put it into the laboratory, put it back in, and they're brand new.
All clean.
Amazing.
All right, well, I think it's great, and definitely urge you to give Dr. Drago a call. It's eonclinics.com. You're right on Swenson Drive in Waukesha. You do free consultations, and it's really great. You take the time to answer a lot of questions and sit down with people. 262-798-0200 is the phone number to call to schedule that free consultation with the doctor. Thanks so much for being here.
Thank you. My pleasure.
Good stuff. Great to see you.
All right, still ahead, we're giving away that high-speed blender. That's right. Stay tuned to see if you hear your name.
And up next, a popular magazine gives out awards for the best in beauty products. We'll have the winners right after the break.
And here's the answer to today's trivia, powered by the HitmanDJ.com. Rosie paid Robbie in meatballs. Oh, you knew it. There we go.
Because Austin told me.
Oh, he gave you the answer.
All right, now from the movie The Wedding Singer. Stay tuned. We'll be right back after the break.